Hi guys, welcome to the Dental Assistant's Corner, and if you are a subscriber, welcome back to the Dental Assistant's Corner. And in this video, I want to just talk really quickly about how I handle nervous patients in the chair. So 9 times out of 10, maybe even 9.5 times out of 10, the dental assistant is going to seat the patient. Now, again, depending on the office, the hygienist or the hygiene assistant, maybe even another dental assistant, will seat the hygiene patients. Now, whether it's for a cleaning or for a dental procedure, a lot of people are nervous about going to the dentist. It's totally understandable. And, I try my best to keep them calm. First off, by introducing myself. I tell them, hey, my name is Teresa. I'm one of the assistants here. I try not to say I'll be the assistant working on you. And again, I'm a hygiene assistant right now, so I'm not about to be doing your cleaning. But even if I go see the doctor patient or, before when I was a dental assistant, I would just say I'm one of the assistants here because there has been times to where I expected to work on them and then we send somebody else in. So that's already making them nervous. Like, oh my God, I thought it was you. Now you brought me this other girl, this other guy that is like, ah. So, I do be sure to do that. The next thing that I do is if I can tell or I can feel that they're kind of nervous, I try to make people laugh. Like, I don't think I'm like a genuinely funny person, but I do like to make people laugh because I do believe laughter is the best medicine. So like if somebody looks like they're about to cry, I'm like, no, please don't cry, because if you cry, then I'm gonna cry, then my eyelashes are gonna fall off. Y'all don't wanna see that, just something like that. And then another thing that I say constantly, and I kind of jokingly say it when people are like, oh, I hate the dentist makes me nervous, I hate coming to the dentist, because we do take blood pressure before every patient, which is what the ADA recommends, but every office does not do that. And then if it's high and they're like, well, I'm nervous about being at the dentist, I'm like, hey, there's worse places you could be. And they're like, right? They're like, you're right. You know what? Yes, I'm blessed to be here. So, that really helps, just making them happy, making them comfortable. And sometimes it's a little hard because people are so upset they don't want to talk. Like, I tried to talk to a patient one time and I was just like, okay, the doctor will be here in a moment. How was your holiday? And she was like, I don't really feel like talking. And it's like, I'm not going to push. You just straight up said you don't want to talk to me, so that's fine. But, you want to make people feel good. You want to make people calm. You want to make people happy. You want to make people laugh from the beginning of the experience. I feel like dentistry is not one of those mindsets of it's not how you start, it's how you finish. The beginning, middle, and end of it is very important. Of course, the finish is important. I'm not saying, hey, I said hi to you, but the dentist pulled the wrong tooth, so it's okay. Of course, I'm not saying that. I'm just saying, you as a dental assistant or a hygiene assistant, you're going to be the second point of contact. Typically check-in is the first, and you're going to be the second, but you're the one in the middle before the big things are about to happen. So thank you guys so much for watching. Give this video a thumbs up and subscribe to my channel as long as you can handle the tooth. Bye.